Good morning. We'll call the meeting to order. We respectfully acknowledge that the County of Haliburton is located on Treaty 20 Mishi-Saugig territory and then in the traditional territory of the Mishi-Saugig and Chippewa Nations, collectively known as the Williams Treaties First Nations. We acknowledge the shared presence of Indigenous nations throughout the area and recognize its original inhabitants as the stewards of its lands and waters since time immemorial. Does anyone have a disclosure of pecuniary interest today? Hearing none, could I have a mover and a seconder to approve the agenda for today? Councillors Burton and Carter.
That the November 27th, 2024 Haliburton County Council agenda be approved.
All in favor? That's carried. So this morning we have the very extreme pleasure of presenting our long service awards. And we have, I think, 5 people on the list, 4 of which are here today. So first up, we have Joanne O'Keefe. Joanne has been an integral part of the county since 2009 when she joined the planning department as GIS technologist. Originally hailing from Newfoundland, Joanne moved to Ontario in 2001 and earned her GIS diploma from Fleming College in Lindsay shortly before beginning her career with the county. In 2022, Joanne transitioned to the IT department, where her technical expertise, friendly personality, and famous baked goods, especially her chocolate chip cookies, have made her a valued team member. She thrives on tackling challenges, working with LiDAR and orthography, creating innovative applications and delivering effective solutions to support staff across the county. Joanne's contributions over the years have greatly enriched the county's culture, embodying professionalism, camaraderie, and creativity in all that she does. And Joanne's been with us for 15 years. Next up is Sylvain, who's also been with us for 15 years. Sil joined the county in August of 2009 as the operations manager. During vacancies in the director's role in 2014 and 2020, Sil stepped up to lead the Public Works Department until a director could be hired. In May of 2022, he was promoted to the Deputy Director of Public Works. And in 2023, Sil again assumed the role of Acting Director of Public Works until he was promoted to Director permanently early in 2024. And it wasn't soon enough. Sil is dedicated to the county and willingly takes on all new challenges. He doesn't shy away from difficult situations and maintains a sense of humor while doing so. Doesn't matter how busy he is, Sil takes the time to speak with you and never makes you feel rushed. Sil is regarded as a team player within the organization. He also takes a lot of pride in his work and instills this in his staff and ensures that he and his team are doing the best, not only for the county, but for the taxpayers living within the county. So congratulations, Sil. Next up is Aaron Turner. Aaron has been with us for 20 years. He began his career with the Haliburton County Paramedic Service in August 14, 2004. During his service with Haliburton County, Aaron continues to serve as a deputy officer and has also in the past worked with the base hospital. So congratulations to Aaron for your 20 years of service. Good, you weren't here. So we also have 2 more awards, one for 25 years and one for 35 years. Ken Beers who is also known as Kenny, started his seasonal career with the county in the summer of 1999. Kenny is a dedicated employee and maintains his sense of humor regardless of the weather conditions that he works in. You'll see Kenny keeping travelers safe by flagging and assisting his colleagues on county roads. He's always a pleasure to work with, and we can rely on his many years of roads experience to get the job done. And finally, Larry Smith, who has been with us for 25 years. Larry started with the county in the spring of 1989. As one of our seasonal employees, we can always count on Larry for his knowledge of the county roads, a smile and a wave. Larry works like a machine, diligently installing and replacing all county road and civic addressing signs. Thanks to Larry and his dedication, people traveling in the county know exactly where they are traveling to because of him. Thank you. So just one final word on that. We really and truly do appreciate the staff that we've got and every single one of them. And to have staff to stay with us for the period of time that they have, it really speaks to the county being a good place to work and a good environment. So I really appreciate their dedication. So next up are our presentations, and we will start with Mark Cox from Point in Time.
Thanks very much for the opportunity. Warden and members of council. I'm here to just give you an update and an overview about what happens in our agency, Point in Time Center for Children, Youth, and Parents. Next slide. As many of you know, because many of you have ended up serving as the county rep from time to time on our board, we're a nonprofit charitable organization providing a myriad of integrated services in Haliburton County for infants, children, youth, and families. And the infants to youth are 0 to 25. We work closely with businesses and other organizations to help provide food and transportation. We're also an umbrella organization serving to sponsor other organizations for community initiatives like Food for Kids, Artists in the School and Community, and FoodNet. We also fundraise to cover things that aren't covered by our funding, community respite, camp, connectivity, Christmas supports, and emergency clothing. We have a full-time staff complement of about 33 people, and we have a volunteer board of directors with 12 people, including our current county rep, Jen Dayu. Point in Time, initially known as Family Services of Haliburton County, became an agency in 1997. It was an amalgamation of 3 different organizations at the time, and it was ministry driven. They basically said all the services for children and youth makes sense to have them in one integrated organization. 2006, we expanded, taking on some additional youth justice services, the attendance center, differential response, which is an intensive service aimed at trying to stop the trajectory of needing to come into either child welfare care or into custody. In 2009, we were funded to provide the Youth Court Worker Program, and that's a youth mental health court worker program because often people that are running into the justice system are doing so because of mental health and substance use issues. 2018, we were selected to be a Youth Wellness Hub Ontario site, and that began the birth of our Haliburton hub, Haliburton County hub. And we formed a connections committee in 2022 to really try, along with other organizations, to take a lifespan approach around mental health and substance use. We're on to vision now. So our vision is that all children and youth really have a chance to achieve their greatest potential within caring, responsive families and communities. We provide supports and services enabling county residents to function at their highest potential. Travis, you're keeping right up with me. Thanks. So like everyone, we have a philosophy, and our philosophy is that we believe in continuums, both in terms of services, but also that mental health and wellness is on a continuum. We believe in collaboration. We know we can't do it by ourselves, and we know that our residents really deserve people to make the best use of our scarce resources to work well together and create synergies. We believe in accountability. We're just waiting our final report from Canadian Centre for Accreditation. And the initial verbal feedback they've given us is that we're a highly functional organization, and they actually had no recommendations for improvement in the areas of direct service delivery, both in terms of mental health services and also in terms of youth justice. We value our staff. We know they're one of our most important assets, and how good they feel in their job has a direct impact on how well they're able to do their job. And we're committed to the community, as well as we take an approach that's not just about helping people clinically when they're most in need, but we also really believe in early intervention and prevention and least intrusive services. Just completed our strategic plan a while ago, and one of the things that's really in there is our commitment to diversity, equity, and inclusion. And we believe people across all population groups should be able to reach their full health potential and are not disadvantaged because of their race, ethnicity, religion, gender, age, social class, socioeconomic class, and other social circumstances. We also know, and I think COVID really helped point this out, is that we have something big and traumatic like a pandemic, that it is traumatic for some, and for others that have experienced trauma because of things that have happened before in their lives, that they can be re-triggered and come back. So we try and use a strength-based approach. We try and, as one organization, serving kids from 0 to 25, we don't want to keep re-traumatizing people from having to retell their story. So we really try and keep that in mind in all the work that we do. We've got a budget of just over $3 million. And I just put that there to show you that we basically have a balanced budget. We're relatively sound, touch wood, economically. And we do provide that income into the county that employs a lot of people and has spin-off impact in the county. A lot of services, early intervention, which is shortened by EI, And it's infant child development combined with supports in the child care centers for children with special needs. We provide family support, youth justice, clinical services, and I'm talking about mental health, substance use, quick access so that people can get into our services usually within two weeks. We provide service in the schools. We provide crisis service. We have a relationship with Peterborough Regional Hospital for psychiatric services. We have a pediatrician once a month and who has a clinic, I think this coming Friday. And I know that you've recently approved some additional supports to help with accommodation for a second pediatrician 1 day a month if we're able to close that recruitment. We also provide psychological assessments, developmental supports, and the youth hub. I don't see anybody asleep yet, so maybe people have had enough coffee or they haven't had a big breakfast. Just an idea of the different services that we provide and the numbers. What we haven't been tracking last year is the number of people that attend the youth hub for wellness activities. Talked about the emphasis on prevention and promotion. When people have a safe place to go, a chance to participate in fun activities in a healthy environment, that was the vision of our youth. And when we started the hub, I think they were so wise. They said that we want a place for youth to be able to come as a go-to destination, not because they necessarily need clinical supports, but that they could be available if they need them. And we see that time and time again when youth decide to start coming to the hub and slowly start to build a relationship with staff and other youth and find the organization credible, and then may decide that they want to see the nurse practitioner about something, one of our mental health and substance use counselors, and that really helps also reduce the stigma attached with the youth hub. What is mental health? Well, it's a whole bunch of things, and I think it includes our emotional, psychological, and well-being. It impacts how we think and how we feel and how we act, our ability to handle stress, relate to others, make healthy choices. And it's also now usually categorized as mental health and substance use. So I talked earlier about a continuum, and I think on one side of the continuum would be, we okay for the next slide, Travis? Struggling, and the next one's thriving. And we're all somewhere in between every day. We're impacted by a whole bunch of different factors, and these are just a few: poverty, stress, genetics, attachment, external stress, and I'm sure you can think of a myriad of other examples. Substance use and mental health. Someone is experiencing mental health challenges. They're not necessarily experiencing a substance use challenge. However, if someone is experiencing a substance use challenge, it's often because they're self-medicating to deal with a mental health component. Other factors. Now, this part's really an eye test. I don't know about for you folks, but the font's a little smaller. So there's intersectionality. Things are never usually just one thing. So gender, race, sexual orientation, income, housing, isolation all come into play. There's global issues with this age of technology and everything being instant. Youth today are impacted by world events in ways that we could never have imagined before, whether it's the environment, whether it's the war in Ukraine. And protective factors play a role. So social support networks, friends, positive school environments, recreation, arts, sports, adults in their lives, and an opportunity to get jobs. So all of those things can certainly be a big part in the plus column impacting people's mental health. What kind of tools and supports people have for coping, and the importance of trying to destigmatize mental health and substance use. When people feel marginalized, they're going to struggle more. And when people feel that you can look them in the eye, say hi, accept them, and treat a mental health like you would a physical health issue, people feel a lot better and they'll have better chance of coming back quicker. So I've talked already about promotion, prevention, and treatment. Some people are busy drawing this in terms of a triangle. Other people draw it in terms of circles. But I think our idea and lots of people's ideas is that we don't want to have to spend a lot of money and a lot of resources, and we don't want people to have to experience needing intensive treatment supports and services if we can provide them with a healthy, accepting community, uh, in, positively impact the determinants of health. I've talked about housing, transportation, food security, and if there's things that we can do to prevent people from actually needing additional services, we're committed to doing it. It's not always the way the funding works, though. Sometimes the funding is just for the top of the triangle, where I think in a lot of ways it would be better spent at the front end. I think we need it all, and we do need that continuum. We're not in any way trying to do anything by ourselves in the county. We know that the medical center plays a role, Haliburton Highlands Health Services, Children's Mental Health Association, and the family that we're working with. So we all have a role to play, to say nothing of the community. Schools have also been funded in recent years to provide social work services, youth justice, child welfare, community living, children's treatment centers like 4 counties, and more intensive supports like live-in treatment with provided by CHIMO in the county, and custody and hospitalization. So often people have more than one need, and often it might be a foot in youth justice and a foot in mental health, might be a foot in substance use and child welfare as well, right? There's a lot of different dynamics. One of the things I just wanted to highlight was the youth hub approach along the bottom. So we're on to that. There we go. Talked about the preventative skills and well-being program, and that plays such an important role. We also have 2 peer support workers that also wear additional hats as doing the skills and well-being program and providing transportation. And we have a drop-in program. And again, the top of the triangle is for the clinical and formalized services. So within the formalized services, we have care coordination. We have a full-time nurse practitioner, and I have to say how amazing that's been. And we're, I think, one of the few hubs of the now 32 that actually do have a full-time nurse practitioner. So we're really grateful that someone that grew up here was willing to come back and dig in. Counseling and substance use, and then we also have psychiatry and pediatric services. So, you know, inflationary trends are tough. We need to have a sustainable system where there's support for children and youth, mental health and substance use needs. And recently we've been meeting with our MPP, and there's been a provincial advocacy push to really try and address the wages between the community-based sector and what I will call the institutional sector, whether it's the hospital system or whether it's the school board system. Our funding levels are much lower and our salary levels are much lower. And so as a field across Ontario, we're finding that our services and other children and youth mental health services are great training grounds, recruitment grounds for people getting out of school. And then as they get some experience, they are then often attracted to the positions that can better help them support their family, that can pay anywhere between 10 and 40% more than the community-based sector. In our community, well, I've been talking mainly about children and youth and infants and families. We know that we're all a community. And we saw that most poignantly in my mind a few years ago when we felt compelled to try and dig in and deal with the contagion that was going on in our community, when we had grandparents who were taking their lives, when we had adults that were taking their lives, when we had youth that were taking their lives. And in a small community, everybody knows somebody that knows somebody. And so these kind of events, because people are so tightly connected, have a huge, huge impact. And really, that's one of the reasons that we started the Connections Committee, because we know that we were losing folks with the opioid related deaths in our county, with the fentanyl that's laced into cannabis, and that people have been really struggling. We've certainly seen children and youth end up inadvertently contacting some of these poisonous substances from their family's use. We know that in our county in particular, everything's interrelated, and that's why it's so important to take a lifespan approach. So we've really been trying to work with people with lived and living experience. I guess it's certainly one of my big learnings from the Youth Hub is how wise the youth are in our community, because having been through what they've been through, they are the knowledge experts. And it's definitely the same for other people in different age groups that have been experiencing mental health and substance use. So we have been trying to do some education with service providers based on the knowledge of people with lived experience about how we can make more services how we can make services more welcoming and responsive. And at the same time, we've been applying for small funds with the United Way and HCDC to do different programs, whether they be educational programs or like most recently, the support group that we ran in Wilberforce. We're awaiting for official word. We have a large grant application in with SUAP, Substance Use and Addictions Program, which is federal money. And should we be fortunate enough, we could be looking at a figure of around $800,000 for peer support work within our county. So the current trends, we know that substance use is on the rise. We know that people don't usually just have one thing going on in their lives. If they're utilizing substance use in a big way, then there could be something mental health going on. There's most likely to be some other things going on. I know things are never just one thing. It's complex, as I've talked about. People living in poverty without transportation, fuel costs, et cetera, et cetera. It really drives the need for a harm reduction approach. And many recipients currently present with complex need requiring live-in treatment, which is beyond our current capacity as an organization. And people often have a multiplicity of presenting challenges exacerbated by the things that we've talked about. Appreciate your time, and I'm open to questions.
Thank you so much, Mark. I have to say on behalf of County Council that we truly appreciate the leadership role that you play in leading an organization that offers so much to our families and children here. And, we would be a lesser place without you. I go to council for questions or comments. Councillor Carter.
Thanks very much for the presentation, and I fully support the direction that you that you have put forward on the promotion and the prevention, because all too often we wait for a problem to get to a stage where it needs treatment, and then sometimes it's not recoverable. My question for you is really about staffing and support. What is your situation in being able to attract staff? I know the situation on retaining staff is very difficult. We have that in a lot of our social services. And then what about as you said, there's additional support that's needed from other groups. What is that availability like to you?
Well, we know that COVID has played havoc with lots of things, including people have decided that they're reevaluating their lives and want a different way of approaching. We've really tried to do everything we can to make Point in Time a great place to work, try and provide a lot of flexibility and supports. And at the same time, it's challenging. I'm almost afraid to say this out loud because, who knows what'll happen tomorrow, but we've recently been able to recruit an additional member of our clinical team. And so we have now just posted a mat leave position for the youth hub. And other than that, right now, at this particular time, we're good. What we have seen is that that's gone up and down a lot. And we've also seen, as you alluded to, Bob, that the sustainability of staffing across the county has also had dips and waves and definite challenges in terms of recruitment and retention. So whereas we started, I don't know, 5 years ago with the Youth Hub, with, idyllic partnership agreements, people haven't necessarily had the staffing to be able to continue with those commitments. And, there's kind of organizations that are based in the county that are struggling, and there's organizations that offices might be in Lindsay or Peterborough that are struggling to get Haliburton staff present here. So, one of our partners ends up with people driving back and forth from Lindsay as part of their workday. And so that there right then means that you've got what, 2/3, 3/4 less staff time to actually help provide the service. I don't know if that's covered.
Other questions or comments? Well, I'd like to thank you once again for your presentation, and I would look to a mover and a seconder to receive the presentation. Councillors Sphiri and McKechnie.
Thank you very much.
That the presentation, excuse me, from Mark Cox on behalf of Point in Time be received.
All in favor? It's carried. Our next presenter is Dr. Natalie Bocking, who is the Medical Officer of Health and the CEO of the HKPR District Health Unit. And I believe Dr. Bocking will be joining us via Zoom. Good morning, Dr. Bocking.
Good morning. Good morning, Warden and council members. Thank you very much for allowing me to come and present this morning. My apologies that I'm not there in person. I unfortunately have a training I have to attend in Port Hope this afternoon, and so couldn't divide myself yet in multiple places. So that's a tool we're still working on.
And it's not a good day for travel, particularly.
Just
Anyway, over to you for your presentation.
Thank you very much. Just confirming with your IT folks, I believe they're going to project the presentation. Thank you, and I'll just ask for it to advance. And my apologies, I believe we had actually submitted the wrong PowerPoint presentation to your team, and it was posted, and we corrected that yesterday. So I believe this is the correct PowerPoint presentation. If anyone had downloaded the previous version, you'll notice that there are some changes. So this deck has 19 slides. I think the other deck had a different number with them. So what I'd like to cover this morning, 4 key things. So we have an introduction or overview, reminders of public health programs and services in Haliburton County. Wanted to highlight some recent initiatives and then touch briefly on our budget for 2025. Next slide, please. So public health is, it was in the spotlight for several years related to COVID-19. And so I think most folks are familiar with the work that public health does in the space of infectious diseases, but aren't necessarily familiar with the entire scope of public health. We, in some ways, have an infinite mandate. I talk about our work as focusing on 4 Ps. We're protection against disease and health hazards, prevention of illness and disease, promotion of well-being, and at a population level. Similar to your previous presenter, we take a life course approach. So from prenatal, before infants are born, up to the full, through the full spectrum of life. Most of our work, or a large portion of our work, is focused on what we call the upstream factors, also things that you might be referred to as social determinants of health. And really, these are the conditions that are broad, things like policy, social systems that determine things downstream, such as whether or not you are needing to use the emergency department or be admitted to hospital. And so really our focus is on keeping people well and at a community level. Next slide, please. There's 5 core functions of the work that we do. So communicable and infectious disease control, environmental health, health promotion, and a large component of our health promotion work is actually policy and working with partners on healthy policy development. We have a core role in relation to population health assessment and surveillance, so measuring health outcomes and the health status of communities, and then emergency preparedness. Next slide, please. So the health unit is governed by a board of health. There are currently 7 members on our board of health and 1 representative from Haliburton County. We serve approximately 188,000 people across 3 large geographies, so from Northumberland County, City of Kawartha Lakes, and up to Haliburton County. We do have 3 office locations and have an office location in Haliburton on Highland Street. Next slide, please. And next slide, please. So we have a large team of very diverse professionals that work within public health. This ranges from public health nurses to tobacco control officers to health promoters, epidemiologists, family home visitors, a wide variety of professionals that work largely in the community and some that are more office-based and providing central or core supports. We do have 13 full-time positions at the Haliburton office. There's currently 1 vacancy, but otherwise the positions are staffed. Many of our staff or employees at the Haliburton office are long-time employees and have very strong connections with the community. They live, work, play in Haliburton County, and we, I think, in particular, value all of those connections that they have with other organizations and the community. Next slide, please. And on to the next slide, please. So the work of health units in Ontario is guided by the Ministry of Health. There are 34 health units were legislated into existence. So the Health Protection and Promotion Act is what establishes boards of health. And the act refers to certain standards that boards of health must maintain. The requirements for health units and boards of health are outlined in the Ontario Public Health Standards. So there's a set of standards, and then there's additional protocols and guidelines. Some programs, these standards, protocols, and guidelines are as specific as defining the frequency at which a restaurant must be inspected. Other protocols and guidelines are as vague or wide-ranging as the Board of Health shall do work in the area of injury prevention. With all of our programs and services, we do have the opportunity to tailor it to meet local needs, in particular with a particular focus on health equity. And the vast majority of our work we do in partnership with other organizations. Many of the work that we're trying to do in preventing illness and disease is not actually things that we control within public health. We think about, as your previous presenter spoke to, the influence of things like housing, education, access to healthcare, income, food security, are not things that are in the control of public health, but are very important social determinants that influence folks' health outcomes in life. And so we work together across communities and with organizations to try and influence that. Next slide, please. And next slide, please. So this is how our organization is set up on an operational level. We have 4 main divisions. Our foundational standards is really our core central supports related to population health assessment, continuous quality improvement, health equity. Our health promotion division has a family health team, which includes both a home visiting service and other broader education and support services. We have a school health team, And we have a healthy communities team, which includes substance use and harm reduction, as well as other focus on other upstream factors such as nutrition, public policy, the built environment, etc. Our health protection team is, again, probably most well understood, includes both our environmental health team and our communicable and infectious disease control team. In addition, it includes our immunization services. And then, of course, we have our business functions that keep all of us with the ability to work the lights on and ensuring that we are meeting all of our obligated requirements as an organization. Next slide, please. So we pulled some numbers from 2023 for Haliburton County specifically, just to give you a sense of the broad range of services. So we've included here a list, for example, of the premises that are inspected on an annual basis. As you're all familiar, Haliburton County has a very large seasonal component to some of its inspections related to recreational camps, beaches, etc. Our clinical services, we do have both a school health nurse and a Healthy Babies, Healthy Children nurse based out of our Haliburton office. And then other immunization services and sexual health services come up from Lindsay when clinics are scheduled. And then there's other components that don't fit as neatly into the other two boxes related to our harm reduction services and our infectious diseases of public health significance. So this is what I would also refer to as reportable diseases. In Ontario, we have a list of whether it be bacteria or viruses or parasites that if someone contracts this or if they have a positive lab report, it must be reported to public health because there's a component of needing to respond to it to protect other members of the community. So our role might be to ensure that they're accessing treatment. It might be to ensure that they didn't contract this bacteria from a food source or some other source that could put other members of the community at risk. And it also enables us to monitor infections and illnesses over time to be able to understand if there's something that we need to do differently to intervene. Next slide, please. I mentioned earlier that we work with many different partners in Haliburton County, and this is not actually an exhaustive list of that, but we do work closely with municipalities, with community-based organizations, and with other institutions such as the hospital, the school boards, paramedicine, etc. Next slide, please. I did want to touch very briefly on a recent change in services, although I think the ultimate take-home message is that it actually is expanding access to dental care for seniors in the county. There was a recent Highlander article that spoke to this with quotes and information from Volunteer Dental Outreach. So a bit of background, in 2019, the provincial government launched the Ontario Seniors Dental Care Program, and this outlines eligibility criteria for seniors to access dental care with certain income requirements. The health unit partnered with the CHC in Port Hope to provide services in Northumberland County, the CHC in Lindsay to provide services to CKL, and then has partnered with Volunteer Dental Outreach in Haliburton County to provide access to Haliburton County residents. Now, this last year, the federal government has launched a comprehensive Canadian dental care plan. And this plan actually has expanded access to residents. So it's a wider, has less stringent income requirements, and has actually enabled more dental providers to enroll in the program to provide services. Instead, the Ontario Seniors Dental Care Program required people to go to very specific sites. The Canadian Dental Care Plan enables dentists themselves to enroll in the program, and then for individuals to identify which provider they would like to attend. So volunteer dental outreach let us know that starting in January, they would no longer be providing services through the Ontario Seniors Dental Care Plan, as they have found that the residents that had previously been accessing this plan are now accessing services through the federal program, and that the federal program again has expanded access and enabled more choice related to dental providers. VDO has ensured us that they're ensuring or supporting all clients that were accessing service through the provincial program. They're supporting them in accessing the federal program, and that there wouldn't be any clients that are denied access if they were for some reason not able to or chose not to access services through the federal program. So I think this is an important thing to note related to services in the county, but an overall good news story. Wanted to highlight a couple of recent initiatives. People may have seen our media releases related to the launch of our data dashboards. These are publicly available, a suite of 8 different dashboards that communicate information related to a variety of different health conditions. It is by either by entire health unit region or geography. So there's Haliburton County specific health data that you can access, again, publicly available. I know that partners now can also access data through that to inform their programming. Also, an example of other reports that we've released, the Addressing Food Insecurity and Poverty report, and then more recently, not seen on this slide, is our situational assessment of the 4-pillar approach to the drug poisoning crisis. That was a large collaboration with the Haliburton, Kawartha Lakes, Northumberland drug strategy. Next slide, please. A couple key public health issues in the spotlight that we've been focusing on and continue to focus on. So emergency preparedness, and this is interrelated with impacts of climate change on health, as well as new and re-emerging infectious diseases. We know that climate change is impacting things such as extreme weather events, flooding, extreme heat, air quality. It's also impacting infectious diseases and the spread of infectious diseases, emergence or traveling of new, for example, tick-borne diseases. So I think those 3 items that you see on the list there are very interrelated. Drug poisoning crisis, and that your previous presenter spoke about this and the interconnected, how complex an issue this is, and the need for many different organizations, levels of our system to be working together. And then the focus on upstream approaches and the really recognizing the role of early childhood development in a life course and health outcomes later in life. And so working with families to prevent adverse childhood experiences. And next slide, please. So looking to the future, in August of 2023, the province announced a policy direction called Strengthening Public Health. There were 3 key components to this policy direction. The first is support for voluntary mergers of small to medium-sized health units. The second is a review of the Ontario Public Health Standards. So this, as a reminder, is that the OPHS outlines all of the requirements for health units. And the third was a review of the funding formula for health units, recognizing that there is discrepancy in how the province funds health units across our province. I don't have any updates related to number 2 and number 3. The Ontario Public Health Standards, there is an updated draft that we provided feedback on. It's now gone back to the province for further consultation, and we don't have a timeline on when we will see the new Ontario Public Health Standards. Similar thing for the funding formula for health units. As I understand, it's still with government under review, and we may or may not see an outcome of this review within the next year. It might be pushed out further than that. With regards to voluntary mergers, as I know you're aware, the boards of health for HKPR District Health Unit and Peterborough Public Health passed motions this past February of an intent to merge, subject to provincial approval and sufficient funding being provided by the province. A business case was submitted to the province on behalf of both boards of health on April the 2nd. Unfortunately, we are still waiting for approval and approval of funding and what that funding envelope would look like. The intent of the merger is to strengthen public health capacity. We know that across the board, across the entire health system, these are challenging fiscal times. And as two small organizations continue to get smaller and face budget constraints, by joining together, the hope and intent is to strengthen our capacity to be able to respond to public health emergencies and maintain services at their current level. So I don't have an update on whether it has been approved. Our timeline for implementation is obviously very short at this point in time. If we don't receive approval or information really within the next week or so, then we will be continuing to plan for 2025 as a solo organization and not a merged entity. Which takes me to the next slide. We did prepare a budget for 2025 as HKPR as a solo organization. I think it's important that we have our plans in place to continue to support that. The recommended budget that was approved by our Board of Health last Thursday reflects a 0.7% increase to our overall consolidated budget and a 2.2% increase of our cost-shared budget. The cost-shared budget reflects the provincial contribution to our base budget and the municipal contribution to our base budget for our total cost-shared budget. Our biggest challenge remains that the province is contributing a 1% increase to our provincial base budget. That was communicated last year, and they've confirmed a 1% increase for 2024, for 2025, and 2026. To realize any sort of maintenance of services and also be able to continue to expand services with continued provincial priorities and introduction of programs, municipal contributions then increase at a higher rate than the provincial increase in order to do that. So our total 2025 budget, you'll see there's approximately 22 million with the 2025 contribution from Haliburton outlined there. And I believe that's the end of the presentation. Would like to thank you for your time. Would like to thank you for your ongoing support. Your board representative from Haliburton County is always very active and supportive and ensures that the voice of your community members are heard at our meetings. So thank you very much and happy to answer any questions.
Thank you so much, Dr. Bocking. I would look to members of council to ask questions or make comments. Councillor Carter.
Hi, thank you very much for the presentation. And I know you're probably not going to be able to answer this question here and now, but one of the things, comments that I'm receiving in the community, as you know, we have lots of lakes here. And as you have mentioned, for whatever reason, the weather is changing, climate is changing, and we're seeing a rapid increase in blue-green algae and blue-green algae blooms. And so looking at your programs and services under safe water and health hazard response, many of the lakes and the people associated with the lakes are looking for the health unit to take a more proactive approach to alerting people and so on once one of these blooms has been recognized. That, we have lots of people here who still take their water from the lakes, and as you know, most normal treatments will not handle blue-green algae, and so that is something that we think should be within the health unit's purview to get the word out whenever there is this type of a problem. It seems to happen in other health units across Ontario, and I would appreciate to hear your comment on that and to determine how we can work together to be able to get this very important thing handled.
Thank you very much for that comment and question. And Warden, if I may just respond very briefly. Thank you for that. And I will flag that for our environmental health managers. I know that they meet regularly with county staff and also with Ministry of Environment, who has shared responsibility in relation to responding to blue-green algae blooms. I'm hearing kind of the emphasis on the need for communication and timely communication related to that, and so certainly can take that away and follow up with our team. It does always become challenging when it's a multi institution response, and so our communication protocol in collaboration with the Ministry of Environment has largely relied on the Ministry of Environment related to that, but I think we can certainly revisit what we have in place to ensure it's meeting the needs of residents.
Any other comments or questions? I would, before I go to you, Councillor Real, I would like to thank Councillor Carter for raising that as an issue, because it is very much an issue in my community of Algonquin Highlands as well, and across the county. So we really would appreciate your looking into that and seeing if we can improve communication streams. Councillor Real.
Well, first of all, thank you for finding the time and coming out and address us. Really been informative. My question is more related to, for instance, in the County of Frontenac, they've got the communal services program that is going into place related to source water and to septic and so on and so forth. Do you know if the health unit in that particular neck of the woods is involved with any of that, or does that go more so under the MOE and other groups?
I don't know the answer to that. Happy to find out. I don't know the answer to that.
I think our CAO might have a comment on that.
Yeah, that's coordination with the MOE.
Any other questions for Dr. Bakke? Well, once again, thank you so much for your time and for your presentation. It's much appreciated.
Yeah.
Could I have a mover and a seconder to receive the presentation? Councillor Schell and Royale.
That updates to the public health and from the public health and to 2025 budget presentation from Dr. Bakke be received for information.
All in favor? That's carried. And our final presentation is from the Haliburton Forth Lakes, Northumberland, a drug strategy group. And I believe that presentation will be led by Kate Hall, and she will be joined by Vidya Sunil and Dane Record. I believe they're going to be zooming in.
Yes, sir.
Good morning, Kate.
Good morning, Warden and members of council. Just checking to make sure my mic is working here and you can hear me.
Can we get a little volume? Go ahead.
Great. Well, good morning, Warden and members of council, and thank you so much for this opportunity to present to you today on the situational assessment of a four-pillar approach to addressing the drug poisoning crisis in our communities. And I'm here on behalf of the HKLN drug strategy and also the HKPR district health unit as a member of the drug strategy. And with me today is my co-worker, Vidya Sunil, who is an epidemiologist with HKPR, and also my colleague and chair of the HKLN drug strategy, Dane Record with PARN, Peterborough AIDS Resource Network. And so we're here today. You can go to the next slide, please. Thank you. We're here today to talk a bit about the situational assessment and the purpose of the assessment, why it was done. Provide a bit of an overview of the drug poisoning crisis. Vidya is then going to present some local data trends. We're going to talk a bit about the four-pillar community response to the crisis and present to you some recommendations for action. So during the presentation, I just want to mention that data and information will be shared related to the drug poisoning crisis in our communities. And behind the data are people, our loved ones, our friends, our families. And so I just would like to enter into the presentation being mindful of that and know that it may be difficult or challenging for some of you in the room to listen. And so I just like to begin and say, please take care of yourselves during and after the presentation. And so the situational assessment, the purpose of the assessment really was to provide an assessment of local drug trends and poisonings, and the four-pillar response or approach that's been used to address this crisis in the County of Haliburton, the City of Kawartha Lakes, and Northumberland County. And the assessment report really describes various data sources. It reviews some programmatic actions that have been taken by organizations within our communities and within the four pillars: prevention and education, treatment, harm reduction, and community safety. And the report is really a collaborative effort, as was mentioned, between the HKPR District Health Unit and the HKLN Drug Strategy. So the drug poisoning crisis is characterized by unprecedented deaths from an unregulated drug supply that's becoming increasingly unpredictable and more toxic. It's a complex health issue that's fueled by largely unregulated, synthetically produced opioids, and then complicated further by contamination with other substances. And this results really in impacts on people who use drugs, their family, friends, and our communities. So some key data from Health Canada for early 2024, so our first quarter, January to March, included that 84% of opioid toxicity deaths in Canada happen in BC, Alberta, and Ontario, predominantly affecting males aged 30 to 39. Fentanyl was involved in the majority of those deaths, 81%, and 61% also involved a stimulant. 84% of the deaths involved non-pharmaceutical opioids. And I'm going to turn it over to Vidya now, and she's going to walk through some of the local data trends.
Thank you, Kate. Morning, everyone. In the next couple of slides, I'll be speaking to the emergency department visits, hospitalization, and deaths trend within the health unit region, as well as by county, specifically focused on the Haliburton County. The graph on the left of the slide shows the age standardized rates for emergency department visits due to opioid overdose-related causes by county, and as well as for the health unit region, and for the provincial data excluding the health unit region. So these are all age standardized, which means that age structure has been taken into consideration for making a meaningful comparison between the counties and also with the province. So as you can see, in terms of trend, the age standardized rates went up from 2019 to 2021, which is our pandemic year, which was the peak in terms of the emergency department visits, and then went down to the pre-pandemic levels in 2022 and 2023. However, I just wanted to point out that not all the overdose-related issues or overdose-related incidents end up in being in a hospital at an emergency department visits or hospitalization. Only a smaller proportion of those end up in a hospital or visit emergency department visits, emergency departments in hospitals. So just wanted to kind of provide that as a caveat. And in terms of the number of emergency department visits per 100,000 population for Ontario specifically, and HKPR comparison, HKPR was 1.6 times than the Ontario rate for 2023. For among the age group, 25 to 44 years of age group had a higher emergency department visit rate compared to the other age groups. In terms of looking by county for Haliburton too, as you can see, the trend was similar to what I explained earlier. Peak in 2021, which was the pandemic year, and then it just dropped to a pre-pandemic level. And in terms of the visual on the right, it is a comparison, just a pictorial representation of HKPR, the health unit region, or the HKLN region versus Ontario. And the highlighted row is the data for the 2021, which was the peak for us. Each person icon in that represent 10 people. So just wanted to kind of provide that as a summary of what the data looks like. Next slide, please. So this is the hospitalization data for the same year, 2019 to 2023. So you can like in comparison to the emergency department visits, the trend is not as straightforward in terms of going up and down. There are fluctuations due to the smaller number of visits or smaller number of hospitalization. The age group was again 25 to 44 was the age group with the higher hospitalization rate. For Haliburton County specifically, you can see a slight increase from 2019 to 2021, and then it's just dropped. No hospitalizations reported for 2022, but then again for 2023, we had 12 hospitalizations per 100,000 population. Or the graph on the right shows the comparison between the health unit region versus Ontario excluding health unit region. So as you can see, our region had a higher rate, hospitalization rate compared to Ontario, 1.3 times the Ontario rate for 2023. And again, the age group was similar. As I said, 25 to 44 was the age group with a higher rate. Next slide, please. So this graph here shows the mortality rate, and these are not age standardized. So these are crude mortality rates, so direct comparison cannot be made. However, you can see the trend in terms of the deaths. The bar graph at the top is showing the data for the health unit region. The number of deaths from 2018 to 2019, there was a slight decrease, and then you can see an increase up to 2021, which was the peak. 50 deaths happened for that specific year for the health unit region, and then the numbers went down to 35 and 36 respectively for 2022 and 2023. So the table below shows the breakdown by the county for 2021. As you can see, the highest number of deaths for all the different counties. For Haliburton County specifically, we did not have any deaths for 2023, but for other years, you can see the breakdown of deaths that happened over the different years. Next slide, please. So this graph here shows this is a pictorial representation just to show the percentage of deaths, how much percentage was fentanyl. For the number of deaths that happened for 2023, 86% of the opioid-related deaths that occurred had a fentanyl percent at the time of death. So overall, for 2018 to 2023, we did have 205 deaths in the 6-year period. Next slide, please. So this slide just shows the percentage breakdown. So the first visual there is the emergency department visits. 4.1% of overall opioid-related emergency department visits were happened in Haliburton. 5.7% of overall opioid-related hospitalization was reported in Haliburton. And then, as I said, indicated before, there were no deaths for 2023. Next slide, please. So this slide shows the opioid prescription trend. So the data here has been pulled from the Ontario Drug Policy Research Network. The number of both new and overall individuals who used opioid for pain management decreased from 2017 to 2020, and then slightly it increased from 2020 to 2021, but then remained similar for 2022 and 2023. This excludes the opioids indicated for opioid agonist treatment and opioids indicated to treat cough, diarrhea of medically assistance in dying. This also excludes over-the-counter medication for pain that contains opioid. So just to kind of point out, there was a guideline change that happened in 2017. Which significantly decreased the number of prescription new users from 2016 to 2017 overall in Canada. This guideline recommended restricting or limiting access to opioids for pain management by people with active substance disorder or history of use. Restricting access to prescription opioids may lead to some people seeking unregulated drug supply. Next slide, please. The slide shows the needle syringe program data. As you can see, there was a steep decline in the needles being distributed through the program beginning in 2019. And at the same time, there was a steady increase in the use of foils that plateaued in 2021, indicating a potential shift in the mode of use from injection to inhalation. Next slide, please. So the next two slides speaks about a summary of the findings from a survey that we had conducted with people amongst people with living and lived experience of using drug. From December 2023 to March 2024, the survey was conducted. We had 146 respondents or responses received, equal split between North and South. The North data included both Haliburton County and City of Cold Lakes. And the South was represented here is for the Northumberland County. We did have a slightly higher number of respondents who identified themselves as male compared to the other genders shown here. Among the age group, we had a higher representation among 25 to 44 years of age group. On the right, that's the analysis of the data and summary of it. So most of the respondents said they used every day or more than once a week the past 6 months. So this is 120 out of 43 people who responded to that question. Among the drug of choice, crystal meth was identified as by 104 respondents out of 146, and fentanyl was identified by 102 out of 146 respondents. Most common method of use was identified as smoking, 141 out of 146, which was the majority. And then there was a smaller proportion who said they used injection as the mode of use, which is 50 out of 146 respondents. Among those who used injection, 2/3 of them also indicated that they reused the injection equipments. Next slide, please. Through the survey, we also asked what are the needs amongst respondents. So then the needs were kind of classified into broader community supports within the community and harm reduction supports. Among the broader supports within the community, majority identified having a safe and secure place to live, opioid agonist treatment, community supports, and healing circles as the need. Among the harm reduction supports, some of the needs, majority identified drug testing kits, better access to harm reduction supplies and equipment, peer-assisted consumption, and targeted naloxone distribution. Among the service of interest, the majority identified consumption and treatment site, and as drug checking services and safer supply program. That's all in terms of data. Before I move on, before I hand it over to Kate, I just want to indicate that there is a substance overdose profile dashboard on our website under health data that Dr. Barking mentioned earlier. About that's one of the dashboards that we have published recently. Please have a look at it, and it has more data with other substances also included in. With that, I'll hand it over to you, Kate. Thank you.
Thanks, Vidya. So I want to speak for a moment about the 4-pillar approach to addressing the drug poisoning crisis. And this model originated with Health Canada and the Canadian Drugs and Substances Strategy. And it promotes a collaborative approach to reducing harms associated with substance use, and it really takes an anti-stigma and a trauma-informed approach. This model is widely used by other municipalities as a drug strategy model to support some common language for the intersectionality around the work that is done in community to address the drug poisoning crisis. So I'd like to start with the first pillar here, prevention and education. One of the main takeaways from the situational assessment is that investment in programs that support families and address youth mental health are critical to reduce the risk of substance use disorders in adulthood. And we heard that earlier through Marg Cox's presentation from Point in Time, as well as Dr. Bocking's presentation as well. And so you'll see on the left-hand side here, we have some programs that are happening in community now that are evidence-based. They're based on a home visiting type of model, and they again are an early intervention to identify and screen for and support people in early families and children in early childhood. On the right-hand side, we have some initiatives in our communities that also are evidence-based that show some promise in preventing or delaying substance use among youth. And so youth wellness hubs, we know, are again an evidence-based model. Ours here in Haliburton has been very successful. There is one coming online in Port Hope and another this year, and another in CKL in the works. There also Preventure, I will mention that as well. The Youth Hub works with the school boards and the local schools to deliver the Preventure program, which is an evidence-based substance prevention program for youth. And I know that it's being offered currently with JDH students, and next term will be offered with students in Archie Stouffer. Next slide. Under the treatment pillar, one of the main takeaways here was comprehensive integrated treatment programs are required. So it really includes everyone. It includes physicians, nurses, nurse practitioners, therapists, pharmacists, and connections to social services and harm reduction. So there are a number of different programs operating in our communities currently. We do have community-based withdrawal management and treatment. We do not have any residential programs currently in our community. However, our residents have equal access to other treatment programs, residential treatment programs in the province. There is a significant wait time currently for residential treatment. We do have opioid agonist therapy at different locations throughout our community. We have rapid access to addiction medicine, or RAM clinic. We have that through our hospital here through HHS. And prescribed safer supply, there are clinics also that do offer this option, one in Haliburton. And then there was a recent announcement by the provincial government about the heart hubs, the homelessness addiction recovery treatment hubs, and these are meant to reflect the local needs of community and connecting people with complex needs to comprehensive treatment. And so these are being rolled out in 2025. Next slide, please. And I'm going to turn it over to Dane here, who's going to speak to the next couple of pillars.
Certainly, thank you, and good morning, everybody. When we're talking harm reduction, it's from a place of understanding that it's not about what you do, when you do, how you do. It's about doing it safely, and certainly connecting with folks where they are at points in their life, their current or their past, and working with them to provide safer, accessible, and equitable resources in their substance use. So with the range of accessible harm reduction programs, we do have the needle syringe program that is happening right across the border counties, particularly in Haliburton. We have a collaborative approach with a number of organizations. We do have wound care and drug test kits that are available. We provide those through our mobile approach, and connecting with folks at satellite and other locations, understanding best as we can in the value of mobile programming and mobile outreach. We work in collaboration as a drug strategy with a number of organizations to work really where folks are. And so it may be where the odd time there's a branded vehicle, such as the decommissioned ambulance at Parn, the vehicle for Durham Community Health Center, or even other avenues such as the community health bus that CMHA provides out in communities, rural and suburban communities. And so when we're looking at how we do the work and how we continue to improve on the way that we do the work, we're really looking at a full scale, best possible approach to connect with communities and also educate along the way. It's not just about providing supply and away you go. It's about ensuring that when kits or when resources are available, the hands that are handing off the resources have the information, the updated detail to make sure that folks are using the supplies and resources safely and have the resources, the local resources available in the event of an emergency. it is important to note here, and I'll go next slide, that as things happen in community, if ever there's a situation where there's a suspected drug poisoning and or overdose, please call 911. You can also call 911 to cancel the order in the event. There are situations where drug poisoning, if there is, for example, naloxone administered, folks using could pop out, snap out of it, and take off. That does happen in the work, but it is something that's worth noting here, that in the full pronged approach when working with um, agencies, organizations, and resources, that sometimes it's just best to cancel order. When we're looking at community safety and looking at the role that policing and emergency services organizations play in this work. It's not about arresting folks and criminalizing substance use and substance use disorders. It's more about understanding and working collaboratively with organizations and community residents to look at diversion services, diversion resources, and really putting emphasis on the fact that substance use is a public health issue in all of our areas, all of our communities. And so working with a number of policing organizations, we're talking about opportunities to decrease criminalization of controlled substances, working with mental health units. There are some units and some police service organizations that have a mental health nurse that goes along with officers in the event of a substance related or mental health related call, and just understanding and supporting the resources that are available. These resources are provided really from the voices of the community. As noted previously with the situational assessment, having the voices of lived experience and living experience, making mention of local services and local resources to have a friendly face, a familiar face that can take the time to connect with folks at time of incident and use a softer handed approach, understanding, yes, that there are rules, laws, bylaws, but there's also the opportunity to look for another way to work with the evidence and work with the multi-pronged approach of health centric service and care in the work that we're doing. Next slide, please. As we're going through, there's some recommendations that came out of the situational assessment. These are recommendations that have been in play from at least 2016, but we were able to really capture some of the findings with a more fulsome approach, and now we have some things in print. And so understanding the experience and expertise of people with living experience, with lived experience in the work. When we say nothing about us without us, as has been mentioned in many of circles, it's important to note that us, being the community, bring them to the tables, the decision-making tables from the beginning, as opposed to looking at individuals as value added or as widgets in the process. Bring folks to the table from the beginning and all throughout the process in order for incremental changes to occur in our respective communities. When we look at mobile approaches, like in Haliburton, we work in a greater mobile approach because we understand from the voices of community that not everybody is going to be stationary and staying in one location. Service organizations do feel the pinch annually and semi-annually with funding and just shifting services around. And so it's ideal to be able to connect with folks wherever they are. And when we look at meeting folks where they are, it means that we have to continue to look at how we can approach service provision, service access, and really address the urgency that comes up in our communities. And so when we're talking about drug strategies, we have the HKLN drug strategy, one of many of strategies across the province, creating a provincial drug strategy task force and looking at having a dedicated coordinator for the drug strategy to be the focal point and the key point of contact to provide trends opportunities and steps ahead and steps forward for areas who are looking for or maybe looking for some assistance, some guidance in how to uh, best or better improve um, the ways and means of their respective communities. It is worth noting here, it's not in our notes, but when we look at community safety and well-being, this is this is required in all municipalities in the province, CSWB in acronym world. It's worth noting that when we're talking about harm reduction, drug strategy, and drug poisoning and opioid responses, we are intentional and tactful in working with respective CSWBs in various areas. And so please, as we go along through our years and terms, don't forget the drug strategy in the decisions that are being made. Real-time data is available on our websites, and I'll touch on those in a moment. I'm going to go next slide and pass it back over for a moment.
Great. Thanks, Dane. I'll just touch on the real-time data. I know that Vidya had mentioned that we have some new dashboards. We have a new dashboard on our health unit website, so there's more data available there, which is great. But we are looking for this is sort of the data we post is after the fact, and we do have a need for more real-time data in order to stand up a more effective response in community. Some of the recommendations for local action here, though, are investing in upstream prevention and early interventions. That, again, was talked about earlier in earlier preventions, and can't stress that enough, how important that is. Proactively addressing structural stigma within our own organization. So that may be reflecting on our own policies and practices. It may be reflecting on our own organizational cultures and looking for language that is stigmatizing. And so that's some reflective practice that we can do as organizations. Expanding our harm reduction service provision. So we know that harm reduction services are evidence-based. We know that they work. As Dane mentioned, we're meeting people where they are at, meeting needs that they've identified. And so it brings a health equity piece to providing health services for people who are vulnerable in our communities. Expanding mobile outreach for harm reduction and medical treatment. Dane again touched on that and how important it is in rural communities with sparsely populated areas. We are also able, through some of our community paramedicine programs, to provide that mobile medical treatment as well through outreach, which is excellent. We want to build capacity within the Haliburton and Kawartha Lakes Northumberland drug strategy. We have been operating without a coordinator, and so all of our partners have been pitching in and making it work, and we've really accomplished quite a bit. We feel that we could do more if we had a coordinator in place that could help continue to keep the work moving forward and sustain the work over time. Establishing direct access pathways to care, withdrawal management, and treatment. We need to map this out so that everyone in all the pillars knows the pathways to care and can access those pathways, make those referrals, those warm handoffs as well, to assist people when they're ready and able on their way and on their path to wellness. And lastly, pursuing evidence-based and health-centered diversion programs. And so that is a focus for community safety, is recognizing the health pieces and treating those appropriately. So knowing that there may be when police come into contact with someone, there's a lot going on potentially, and they need to be able to sort through what is what is a criminal offense, what is a health issue, and be able to offer those pathways of care for people so that they can support them on their way to wellness. And next slide.
And so with next steps, opportunities for next steps, I'm going to bring back CSWB, bring folks with lived experience and living experience to the tables. If you're unsure of who and how, connect with community organizations in Haliburton County. There's John Howard, there's us at Parn, we'll make the trip out. CMHA, Point in Time, there's a number of organizations, even the library has resources and info to get folks to the tables to connect. The reports that are being provided and punched out quite frequently. We're going to be sharing the report and continuing to share our reports and communications and recommendations with communities, just on a more frequent basis. This is an avenue, for example, where we can connect directly with the residents. Please invite us to have a more fulsome dialogue later on. Looking at supporting priority settings and planning for next year coming up, 2025, with the Drug Strategy Network, Steering Committee, and local drug strategy groups. While we're an HKLN strategy as 3 counties, there are local strategies that are in place and in play, and just working together, continuing to work together to meet the needs of our respective areas is where we'll see and continue to see some greater success. Looking at the community partners, working within the 4 pillars and prevention, education, harm reduction, community safety, and treatment. Looking at adopting some recommendations to work in 2025 that aligns with not just organizational priorities, but also looking at the collaborative strategic approach of the HKLN drug strategy. And also not noted here is for folks who have questions or concerns of what's the police's role, what are the opinions of policing organizations and associations, I would recommend taking a look at the Ontario Association of Chiefs of Police's OACP. They do have reports available. They do meet frequently on subjects such as this as a provincial collaborative, and their reports do have some recommendations that they want to bring to light. So it's not just left in a vacuum. We want to make sure that the reports that we're providing as a strategy, that we're providing all of the reporting. And so just making note of that and inviting policing associations to these conversations as well. And next slide. And with that, we just really want to say thank you for the time and the opportunity in inviting us to speak with you all today and connect. We'll answer any all questions, comments, concerns, feedback. And if there's any questions that come up later on, we do have the situational assessment report and other reports and infographics on our website, hklndrugstrategy.ca, as well as a contact system available through email, harmreduction@hkpr.on.ca. And if you're just looking for maybe a frontline, ground level inquiry, again, connect with any community organization that works with human and social services.
Thank you so much to all three of you for your presentation, and more particularly for the work that you do on the 4 pillars of our drug strategy and reducing harm in Haliburton County particularly. I would ask any members of council if there are any questions or comments. Deputy Mayor or Councillor Dayu.
Thanks so much. That was really interesting. And I'm amazed, this morning we've had 3 truly extraordinary presentations that overlap quite outstandingly in terms of approach and how we understand how people arrive at a crisis, and that it's complex, and the social determinants of health, and the importance of understanding root causes, even if we can't tackle them, and very much taking a compassionate and empathetic approach to folks who are facing crisis. And I hope our federal and provincial policymakers will align their budgets accordingly. Of course, that's a bit out of our hands. I do have one question regarding the presentation, and it is for Ms. Sunil. When you spoke, it was in page 5, 6, you offered some disaggregated information about trends, emergency department visits, hospitalizations. And when I first looked at that, I thought, yeah, okay, yeah, I see why Haliburton would have in most cases, a lower number on the graph because we probably have a lower population. And then I realized, no, this is, as you've written, this is a rate per 100,000 population. So we're talking about pairs and pairs. We're not talking about apples and oranges. And I wonder if you would be able to offer any insights as to how we could interpret the data, which says that per 100,000, Haliburton might only have 36 emergency department visits versus 142 for Kawartha Lakes. Or in hospitalizations, the big elephant in the room, I think, is 0 hospitalizations for Haliburton in 2022 versus 27, for example, in Kawartha Lakes. If we're talking about rates per 100,000, I struggle to come up with an interpretation of why our numbers are so different. And I wonder if you have any additional insights you could share with us to help us to understand that.
Thanks for that question. Definitely great question to kind of understand and put this in a layman perspective. So the rates, as you kind of identified, it helps us to compare between the different geographies. So you're right on in terms of when you look at the absolute number, which we don't have here because we don't want people to compare absolute numbers, which is not the right way of comparison. But in general, when you're looking by county, the numbers are, Haliburton County have lower number, but again, like when you extrapolate into the whole population structure, it's lower definitely compared to the city of Kawartha Lakes or Northumberland County, which we are seeing higher numbers compared to Haliburton. So the per 100,000 population is it might be like 1 per 20,000 population. When you extrapolate it into like 100,000 population, that's how the numbers change to like rates. So we kind of what we look at is which age group has the highest number, and then kind of have that population denominator for that age group within Haliburton County, in the analysis perspective. And that's how we kind of come up with the age standardized rates for 100,000 population. So, we have a lower number definitely for Haliburton in terms of rates when compared to the other 2 counties, and that's how it is represented in the graph as the number by 100,000 population. Does it explain it in terms of what you're looking for, or?
Yeah, it does actually, because it helps me to realize that even though you're going by rate, the absolute population still impacts the rate in a way.
Absolutely.
Yeah, okay, I get it. Then could you give us any further insight on the 0 hospitalizations? Is that a blip or?
No, there were no hospitalizations at all for Haliburton for that specific year.
Oh, okay, thank you.
Councillor Carter, then Councillor Rail.
One of the other possible situations is, of course, you don't have any information on the usage of so, if 5 times more people are using in another area, well, then you would have increased adverse outcomes also. So that could be part of it. So this is I guess in the last 2.5 weeks, this is the third time I've heard this presentation, um, which shows that I'm in too many committees. But again, I have and I know this is an impossible question to answer, but as we saw today in the various number of programs that we have across healthcare, it all comes down to how much healthcare can we afford. Hopefully we can afford everything, but there's no numbers here again on how much all this is costing. And what is the cost of this program and what it does versus the cost of another program and what it does. And I think that that's something that needs to be in these presentations going forward. And then the other comment is, which we stated at one of the previous meetings, is that the amount of effort and money spent is not in the area of rehabilitation and treatment and getting people off of these products. There's a lot of money being spent on supplying needles and other areas. And it would seem to me I would like to get people off of the drugs, or getting people not to start the drugs in the first place, as we heard in our first presentation this morning. And so, the I'm not totally in sync with the 10 recommendations, and the knowing the amount of money that is being spent so that we could look at this versus other healthcare choices that we have to make.
Before I go to you, Councillor Real, Kate, did I see your hand up earlier?
I just had a comment to the last point that was made about hospitalizations, and just wanted to stress again that the number of hospitalizations that we see in emergency department visits in particular, is just that is the tip of the iceberg. That is what is reported. That is a very small segment of what is happening in community. And so we know that not everybody goes to hospital, not everybody calls 911. And we know that in the community of people who do use substances, that again, they do take care of each other. And part of that is just due to the experiences that they've had interacting with systems. And the stigma that they faced. And so some make choices then not to call 911, not to go to hospital, and to deal with the situation themselves. And so when we see zero, it doesn't mean that it isn't happening. It doesn't mean that we don't have crisis in our communities. It doesn't mean that people are not overdosing. It means that we're only seeing what is reported.
Thank you.
Councillor Real.
Yeah, the thing of it is I never took drugs, but I started to smoke when I was 14. And I smoked regularly from the time I was 14 going forward. And the reason I did that was because it was socially acceptable at the time. It was something that young people did to rebel. It was all the things that motivate young people to do what young people do. I thought I was becoming much more independent because now I could do what I wanted to do, until I realized at the end of the day that the cigarette controlled everything I did. And it wasn't until I was a whole lot older that I realized that just wasn't the way it was to be. And the people that I associated with also came to that same conclusion. The long and the short of it, I didn't quit until I decided that I wanted to quit. I could be influenced by a dozen different things. So my question isn't so much to you, but it's to the news media and the other people that are listening to this particular thing. Is there any way that those people could possibly put more information into, this is going to be right up on this particular meeting to start with, but the contact information, you've told us and explained to us where all that information can be gained, which people, young people who do not have to talk to anybody except go to the website themselves and to find out the information on their own. and make their own personal decisions. And then the other thing would be to address the social media champions who in that same general age category are influencers in themselves. If they could go and do exactly the same thing and promote it to the people who are going to be, if not part of the problem today, certainly part of the problem tomorrow and going forward, because as they get older, we're not talking about cigarettes anymore now, we're talking about opioids. You don't quit them unless you really have some assistance or you don't get on them in the first place. So that's basically all I have to say, but if it could be done, that would be super.
Thank you. Go ahead. Dane.
Sorry. So I just wanted to thank you, Kate, for bringing that up. I just wanted to add on to something on our website. As I said, there is the dashboard which has the weekly report where we look at and assess, the number of calls that the emergency EMS receives or police receives on a weekly basis. And to what Kate mentioned, there are several that the call is taken by the EMS or police. They go to the site, and then the person doesn't end up going to the hospital. So just to kind of give also some additional information there. And on our substance use dashboard, there is the hospitalization data for different substances, including opioid, which also has the mental health component to it. So when you get a chance, look at it. Because mental health component of the substance use related visits is also, adding on to the number of hospitalization and emergency department visits. So the dashboard has some mental health components added to our total number of hospitalizations. So just wanted to provide that as an additional comment if people wanted to take a look at it. Thank you.
Any other questions or comments from council? Just in response to your comment about financing, I find that I can't help but be frustrated when you see things in particularly Dr. Bocking's presentation, where the province is committing to 1% increase over a 3-year period, and yet we consistently have increases like 5%, and more the responsibility falls to the municipalities, and that is just not right. It doesn't help folks like yourselves who are trying to run a program with less funding than you probably need. And that's something that we continue to acknowledge and try and work towards improving that. Go ahead, Councillor Fury.
Well, we heard 3 presentations this morning, and every one of them dealt with some of the same things. I don't understand this, why we can't have one organization that deals with that issue so that they can concentrate on it. Like, we got all kinds of fancy presentations here, but I didn't hear a whole lot of solutions other than reach out to the community. It's a terrible situation we've got. I understand that, but it's consuming nearly the police. It's consuming every occupation in the public sector. We gotta zero in and we got way too many organizations. I'm going to say it right now. And the sooner that we amalgamate some of them and get to complete some clear results, in my opinion, it'll be better.
Thank you once again for your presentation. Could I have a mover and a seconder then to receive the presentation? Councillors Royale and Carter.
That the presentation regarding situational assessment of the 4 pillars approach of addressing the drug poisoning crisis in the county of Haliburton be received.
All in favor? That's carried. I think I'm going to call for a very brief break. Let's say 10 minutes, and then we'll get back to the agenda. Welcome back to the open session. Next on the agenda is the consent agenda. Did any member of council wish to pull any item from the consent agenda for discussion? Hearing nothing, then could I have a mover and a seconder to receive the consent agenda? Councillor Dayu and Burton.
That the items listed under the heading consent agenda from November 27th, 2024 be adopted as presented.
All in favor? That's carried. You'll just note the correspondence from the Eastern Ontario Wardens Caucus, which I believe you'll just receive for information unless there's comment. I'm hearing none. We will then move down to other reports, starting with the Community Safety and Wellbeing update. Good morning.
Good morning, Warden Danielson and members of council. Before you is a bi-monthly Community Safety and Wellbeing Status Report for November 2024, largely following up with updates to projects, programs, events, and other items that were detailed in the September bi-monthly report. A few exciting firsts for the county have taken place over the past 2 months, including the first Haliburton County Service Providers Expo. It was held in Minden in early October, and it brought together more than 70 service providers from 40 organizations and agencies to meet, network, information share, and collaborate face-to-face. Some of these service providers had never met face-to-face before, and some had not been to Haliburton County. So it was truly a helpful opportunity for people to connect and move forward, providing best services for residents. Now, almost a month and a half later, I'm still hearing service providers recall something that they learned from that event or be able to more easily connect with colleagues to best support clients. And in the spirit of a room full of helpers, it was especially meaningful to see that when the pans of fresh bread for lunch wouldn't fit in the ovens, the community member serving breakfast ran the pans over to her bistro bakery to help bake them before lunch was served. So collaboration truly is everywhere. Another exciting first was the Identification and Employment Supports Clinic held in Haliburton last week. There is information about this in the report, but I know that sometimes we see numbers and we don't always understand the full impact of an event. So I wanted to share some information about that. It brought together Service Canada, Service Ontario, and the Canada Revenue Agency alongside local services and organizations to serve about 25 people with low barrier services all in one spot. Folks who attended received multiple supports and services, some as many as 7 supports and services in one place. One person was able to, with support of the agencies in the room, accessing their account information and providing required documentation on site, file their taxes. So when they filed their taxes, they received an almost $1,000 refund. Because they had done that, that opened up some other benefits that they were able to access, including a $1,000 Climate Action Fund benefit, and it reinstated a $10,000 child tax benefit. Without those benefits, and having been recently laid off from their job, bills were piling up, and they and their children also had no heat. Heat Bank was on site, able to gather necessary details, collaborate with another agency, work with the fuel provider, and rectify the situation so the participants' prepay balance owing had been paid and a full tank of fuel delivered within 24 hours. Another person entered the event feeling completely hopeless and distraught, really overwhelmed with where to start. They started at the job table, heading over to Fleming Crew to seek some help with employment. So they were able to look into job opportunities. They were able to get an ID card that they hadn't been able to access. They were able to access some community support programs, and they really left with renewed spirit and such gratitude. So the room was really filled with helpers again, and I can't say enough about the one-on-one thoughtful care that people received there that day. Accessing these services will be life-changing for some. Other highlights in the report include the continued evolution of the Community Mobile Outreach Program, some new locations and many additional service providers joining, which meets people in need of some supports where they're at throughout the county. The return of Service Canada outreach programs that served about 55 people over 2 days with services including CPP, OAS, GIS, EI, and social insurance number support. Of course, the upcoming inaugural meeting of the Haliburton County OPP Detachment Board is this Friday, November 29th, in the morning from 9 a.m. to 12 p.m. And then the second annual CSWB Youth Art Exhibition is being held at the Rails End Gallery this Friday, November 29th, in the early evening from 4 p.m. to 5:30 p.m., running until December 20th. I'm happy to take any questions you might have about this report.
Questions for Ms. Tiffin? Hearing no questions, could I have a mover and a second then to receive the community safety and well-being status report? Councillors Carter and McKechnie.
That Haliburton County Council received staff reports CSWB 09/2024 as information.
All in favor? That's carried. Next are reports from the clerk's office. First being the meeting schedule for 2025.
Good morning, Warden Danielson and members of council. The proposed meeting schedule for 2025 is before the members today. And the only request of staff is that the December meeting that could be held the third week of December in 2025 be moved to the second week and the inaugural session be on the Tuesday.
Any questions or comments on the meeting schedule? Conflicts? Hearing none, could I have a mover and a seconder then to approve the meeting schedule? Councillors Feary and Carter, thank you.
That the 2025 County Council meeting schedule be approved.
All in favor? That's carried. Next is a report on nominations for warden.
Thank you, Warden Danielson. The clerk's office received 2 complete nomination forms for the office of warden in 2025. So therefore, on December 10th, we'll be holding an election. The forms received were from Councillor Burton and from Councillor Carter.
And the nominators are to speak to those nominations today?
We have that scheduled for the inaugural session or the election.
Okay,
Thank you.
so I can tuck my notes away. Any comments or questions? Could I then have a mover and a seconder to receive the report? Councillors Shell and Feary.
That report CLK 08/2024 nomination results for the office of County Warden for 2025 be accepted.
All in favor? That's carried. Thank you. Under Public Works, we have a report on agreements being established with the Snowmobile Association. Good morning, Sil.
Good morning, Warden and members of council. The first staff report is in regards to the Haliburton County Snowmobile Association land use agreement. And essentially it's for 2 county properties, one being the rail trail and the second being a pit that we have up in Haliburton Lake area. These agreements have been amended to reflect changes in liability coverage and responsibilities as well for the Haliburton Snowmobile Association. Below in the report are the highlights of the changes. The majority of the agreements have been updated for wording in the agreements for the changes. Be glad to answer any questions.
Any questions on the agreements? Hearing none, could I have a mover and a seconder then to approve them? Councillors McKechnie and Burton.
That the Haliburton County Council approved the land use agreements between the County of Haliburton and Haliburton County Snowmobile Association.
All in favor? That's carried. Next is your work plan update for November.
Yes, the next report is our work plan, the Public Works work plan update. Just a few items to note that our capital projects have all been completed. And as you saw this morning, our winter operations are well underway. Staff were out this morning tending to their roads. As well as the engineering department is actually in process of analyzing the traffic counts that we perform in the spring, summer, and fall. And we'll bring a report back to council with the results if of any changes in what we're going to do with those to mitigate those changes. And I'll be glad to answer any questions.
Any questions on the Public Works update? Councillor Rael?
No questions, just a comment. I'm still getting positive feedback on the overall improvements made to 503. So congratulations on that. Thank you.
Yeah, thanks.
Any other comments or questions? I've got to have a mover and a seconder then to receive the Public Works work plan update. Councillors Carter and Rael.
That report, PW 2024 Public Works Work Plan Update be received.
All in favor? That's carried.
Thank you.
Thank you. Next is reports from our planning department. Good morning, Elizabeth. First is information on the provincial planning statement.
Thank you, Warden Danielson. In an effort to be efficient on time today, I'll forgo a formal presentation. However, if council has any questions, I'd be happy to answer them at this time.
Any questions on the planning update? Wow, getting off really easy today. Could I have a mover and a seconder then to receive that, the update on the PPS? Councillors Fury and Carter.
That report, PLN 17/2024, 2024 plan, provincial planning statement overview of changes and corresponding OP update be approved.
All in favor? That's carried. Next is your planning update.
Thank you again, Warden Danielson. I thought I'd touch on two components of this report quickly. The first being the growth strategy. Through staff's review of the final draft of the report, we found some discrepancies in projections of growth and ability to provide for said growth in terms of land and servicing constraints. Our consultant, Watson and Associates, is currently refining the report to ensure the projections for growth are realistic and achievable. They're anticipating the updates to be complete in the next month or so, and the final report is slated to be presented to council early in 2025. Pertaining to the LiDAR project, we are currently working on some mapping refinements with Ganaraska to ensure the two-zone flood limits of the rivers that were flown for the LiDAR project are accurately identified. And this is imperative for the ability for this mapping to be used for planning purposes. So if council has any other questions, I'd be happy to answer at this time.
Questions, Councillor Carter?
So just on the growth, is that the same consultants that we had when we were looking at the development charges?
Through you, Warden Danielson, it is the same consultant. The RFP was for both components. So once the growth strategy is complete, we will move on to the second component, which is the development charge background
Yeah,
study.
no, that's fine. I
Yeah.
just wanted to make sure that we didn't have two different.
No, it's the same
Projections.
company.
Okay, and the second one on the LiDAR, we in Minden are currently having some difficulties with folks who, kind of don't think that the river will ever rise and want to build, and the new maps clearly show that there's that there is they'd be trying to build in a floodplain. And I guess just the comment is if we can get those finalized as quickly as possible, because, people are looking at old maps and saying, well, it never was a floodplain. You guys must have done something different, but, so the sooner we can get it, the better. Thanks.
Any other comments? Councillor Fury, sorry.
In the new official plan, I think, well, I know waterfront's pretty well covered. I think it's pretty well built on most places, but some of the rural municipalities and rural areas in all our townships will have to understand that if technology changes and that stuff in Frontenac works, that these people be allowed some residential development, because right now, and I don't know how you phrase that, but some of the municipalities here now can't get a house severed off. So I think we need to look at that policy, providing there is going to be adequate health services and water or sewer and whatever. If you can, because otherwise we're so restricted in some of these townships like Algonquin Highlands. I'm thinking we need housing and we need people. And if the road's already paved and we're servicing with a bus, like what costs are we adding? So I just like you to look at that when you're going through.
I know one of the things about speaking to communal servicing, and one of the things that I was disappointed to hear from Frontenac during the housing forum was that it takes much longer for approvals for communal services if it's coming from a municipality than it does from a developer, and that seems backwards to me. Yeah, and I just wonder, if at some point in time we can't make some points with respect to that, because I know that, both Highlands East and Algonquin Highlands, and particularly Algonquin Highlands, where we have no water and sewer services, we really need to see that stepped up, because we'd like to move forward with some development, and at this point in time, really can't. Any other questions, Councillor Royale?
Staying on that same subject, is there anything that we can do? I mean, I appreciate that at the times there are possibly delegations are long gone, and I don't know if there's going to be any value in doing it anyway. But you're right. We have projects that in Highlands East are going to be possibly impacted by that as well. And so now the good news is, or the bad news, is it doesn't make sense for the municipality to get involved. Because if we're only going to slow it down and create more red tape, should we, like where do we stand? And then you got the second question: if the developer at some point in time goes defunct, now what do we do? And now we have to take over something. So it'd be nice to have more clarity on that. I don't know how to get it, but it'd be nice if we got it.
Elizabeth, did you have a comment you'd like to make?
Yes, thank you, Warden Danielson. So from the provincial planning statement perspective, it's the first time that the province has actually recognized communal servicing and partial servicing in rural areas. So the province has opened the door, and so before they were silent. So I would say that if there is an interest, we can reach out to our provincial partners to see if any sort of regulations or additional information on how that would work for municipalities is going to be released. We can absolutely do that and provide additional information if there is any to provide on that.
They may have opened the door, but they only seem to have opened it a crack. Mr. CAO.
I think Councilor Carter got it.
Okay, go ahead.
We may have the same comment. I think the municipality has to get involved, because, we, at the end of the day, we're going to have one of these municipal service corporations. We, by definition, I think, get involved. And I think the biggest issue is, yes, we now have recognition from the ministry, but it's the bureaucracy of the Ministry of Environment that seems to be the big challenge for all these at this point.
Go ahead.
So thank you. Just to build on Councilor Carter's comment. So yes, the two things have to happen. So as Ms. Purcell talked about, so we're going to have to modify our official plan documents to allow for communal systems. I guess I might be the only one old enough to remember when they actually used to have communal systems. So, but having said all that, the municipality is involved because we will be taking them over. It's not a matter of allowing a private entity to run a communal system. It would be in partnership with the municipality. So that would have to be part of the considerations and due diligences as reviewing of the document. And to Councillor Fury's comment, it does free up some land, but it also there's still regulation goes with it, so it's not returning to the Wild West of the 90s, the 80s, 90s. It still will be controlled, but just another opportunity to allow us to grow, particularly in areas like ourselves where you have the traditional municipal servicing isn't an option. It's just too expensive, both on the install and on the maintenance side of it. So that's all part of the updating that we'll be doing going forward, and communicating with the local municipalities is the acceptance of it. EOWC and AMO are working hard as they can to convince the MOE that they need to get out of the way. There's already policies in place. They just need to follow them. And so that's kind of the other part that's being worked on as well. And Frontenac County, as you've heard in their presentations, has been doing this for, I think they're going on 4 years now, and trying to work with the MOE on the approval side of it.
Any other questions or comments? Could I then have a mover and a seconder to receive the planning department work plan updates? Councillor Dayu, Councillor Fury.
That report PLN 19-2024 Planning Department Work Plan Update be received.
All in favor? That's carried. And next on the agenda was a information technology work plan update, but unfortunately, Mr. March is ill, so no one will be presenting that. So unless there are any particular questions, we would have to have a mover and a seconder to simply receive the report. Councillor Royale, Councillor Carter.
If I might, if there's an opportunity for questions, I can take that. We can take back to Mr. March on his report. We can do that as well.
Were there any questions on the report? Councillor Carter.
Wasn't the question, just wanted to say thank you for getting that orthography portion completed. If you haven't had an opportunity, the 2023 pictures are available across the municipality, and they're now much higher definition than previous ones. And looking around, you can see some beauty, some wonder, and some really scary stuff.
Thank you.
And so that report ITS 09-2024 Information Technology Work Plan Update be received.
All in favor? Carried. Next is the update on EM, or Emergency Management Program. Good morning, Chief Waite.
Morning, Warden Danielson, members of council. Just prior to uploading all of our information to the portal for emergency management compliance for this year, I just want to provide council with the updated sort of year-end accomplishments of the emergency management program for the county. So we have completed all the required requirements for compliance for this year, and I'll be uploading them to the portal within the next week or so. It has to be uploaded prior to December 31st. The second sort of highlight of this is sort of twofold, and that is thanks to Public Works and Souls Department, we'll be installing a card lock system at the Tory Hill base. It'll serve twofold. That'll be when ambulances are there, they can refuel there, so it's cheaper fuel. But the second big piece is in the case of power outages and gas stations not available for ambulances to refuel, which we have experienced in the past, we'll now have a refueling depot that's fairly handy, that the ambulances can stay full of gas and respond to 911 calls. So happy to
I
answer
think
any.
more than handy.
Yeah. So I'm happy to answer any questions.
Questions for Chief Waite? Hearing none, could I have a mover and a seconder then to receive the emergency management update? Councillors Fury and Carter.
That EMS report EMS 07/2024 emergency management update be received.
All in favor? That's carried. Reports on external boards and agencies have all been covered under the consent agenda. Next on the agenda is a draft resolution from the Eastern Ontario Wardens Caucus, which I'm sure you've all received, and is the Wardens Caucus has done an awful lot of work on the infrastructure gap and the concerns that all municipalities have with respect to that. So unless there's any questions, could I have a mover and a seconder then to move forward with that resolution? Councilors Carter and you.
With your indulgence, Warden, I'll not read
Like
the
to speak.
17 recitals and just read the meat of it, if that's acceptable.
That's acceptable.
Thank you. Now therefore be it resolved that the County of Haliburton joins the Eastern Ontario Wardens Caucus, the Association of Municipalities of Ontario, and the Federation of Canadian Municipalities in calling on the federal Ontario governments to immediately and sustainably partner with municipal governments by investing in both new and ongoing maintenance and repairs of municipal infrastructure in Eastern Ontario's small rural communities. And that the federal Ontario governments immediately review data and work together to implement solutions based on the EWC's municipal infrastructure policy paper in partnership with small rural municipalities.
All in favor? That's carried. Thank you. Are there any notices of motion? Question for you, Mr. CAO. Do we not normally have bylaws after closed session? Or has that changed?
No, this is the order the council approved. Sorry, this is the agenda order is approved.
Okay, so we do have a resolution with respect to the bylaws that are listed. Unless there are any questions on any of them, could I have a mover and a seconder to approve the bylaws? Councillor McKechnie and Shell.
That the following bylaws listed under the heading consideration of bylaws being enacted and passed. A bylaw to appoint Secretary Treasurer and Deputy Secretary Treasurer to the Land Division Committee for the County of Haliburton. A bylaw to appoint the council members to the Land Division Committee for the County of Haliburton. Bylaw to authorize the warden and clerk to execute the agreement for the use of the Haliburton County Rail Trail with the Ontario Federation of Snowmobile Clubs and its members. And bylaw to authorize the warden and clerk to execute the agreement for use of the Haliburton Lake Pit with the Ontario Federation of Snowmobile Clubs and its members.
All in favor? That's carried. I believe now we would move into closed session. Could I have a mover and a seconder then to move into closed session? Councilors Fury and Carter.
That in accordance with section 239 2F and K of the Municipal Act, council can convene in closed sessions to consider the following subject matter: advice is subject to solicitor-client privilege, and a position plan procedure criteria or instructions to be applied to any negotiations carried on or to be carried on behalf of the municipality or local board.
All in favor? Carried. Welcome back to the open session. The next item on the agenda is the confirmatory bylaw. So could I have a mover and a seconder to pass the confirmatory bylaw? Councilors Burton and Carter.
That bylaw 4275 being bylaw confirm the proceedings of the November 27th, 2024 meeting of Haliburton County Council be considered to be read a first, second, and third time and finally passed.
All in favor? And finally, a motion to adjourn. Councilor McKechnie, seconded by Councilor Rail.
That the November 27th, 2024 meeting of Haliburton County Council be adjourned at 11:48 a.m.
All in favor? That's carried. Thank you, everyone.